City County COVID press briefing. My name is Peter Zanoni. I'm Corpus Christi City Manager. And today is not Dr. Bird from Texas A&M Corpus Christi. They are presenting on Tuesdays now to accommodate Dr. Bird's schedule at the university. Dr. Bird and his team presented on this past Tuesday. So today and going forward, Thursdays will be an update from staff, including myself, Annette Rodriguez, our Public Health Director, and then comments from Judge Canales and Mayor Joe McComb. So I'm going to begin by giving the community an update on the cases, the number of new COVID cases for Nueces County, talk about the recovery rate, hospitalization, and number of deaths. And then following my presentation, Annette Rodriguez will give an update on some of the health matters, and then Judge Canales is here, and Mayor Joe McComb is in a meeting, and he may be here. We'll see as the time progresses. Okay, so we're going to show you the first chart. Today, the city county is reporting 63 additional positive cases for Nueces County. And we have been talking to the community about an outbreak situation at a detention facility in Robstown. And today, with the 63 number, there are 0 cases from the detention facility. However, additional employees are being tested, and so we may have additional numbers to add tomorrow or the next day from that outbreak situation. But the 63 today, these are just non-outbreak numbers for Nueces County. We also today received a data drop from the state of 29 additional positives. There were a few in July, and then most of those positives are in the month of August. We have not distributed those today because we still need to get some certainty in the distribution dates. And so I'll show you on the next chart more on that. But so 63, also on today, 63, that number is our 7-day daily average. So we're right on that daily average. If we look at the numbers, go back please. If the 158, a big part of that is the detention facility in Robstown. But if you look, we're in the 63 is our daily average, which is better than the 363 we were at in July. But we still want to continue to drive that number down over time. And that's what Annette's going to talk to us about, as is the judge. Okay, on the next chart, you can see a longer time frame. And you can also see the yellow, the data dropped numbers assigned to the right day. So that just gives you a visualization of how the data drop impacts our numbers. Okay, on this chart, it puts the data drop numbers on top of the regular reported numbers, and those regular ones are in the blue bar, and then the data drops are the yellow on top. All right, so one thing we like to tell the community is how we're doing in the recovery rate side. You can see here, we're doing good in the recovery. That's in the orange slice of this donut chart. So close to 11,000 recovered, but we do still have 7,350 approximately persons that are active with the COVID virus in Nueces County. And so that's a big number, right? When you think of it, 7,000, close to 400 people, 7,400 have COVID, and they should be quarantined and isolated, and so that virus isn't spreading. This chart shows the deaths, 339, and I'll get to more detail on that in a moment. Okay, regarding hospitalizations, not too much change, a decrease of 2 in the hospital. Yesterday there was 175 in the hospital. Today there's 2 fewer, so 173 in the hospital. And of that 173, 76 are in intensive care, meaning they need more help than a normal person that's recovering or a general person that's recovering. That number of 76 is the same as yesterday. And you can see both in ICU and hospitalizations, the numbers are coming down, but it's a slow downward descend. Okay, and then number of deaths. Today we're reporting fewer. This is a low number, which is good. So 3 additional deaths for today. So 339 is the total number of deaths for Nueces County since we began with COVID. Yesterday, we had 336 deaths we reported, so with the 3 new that we're reporting, that takes us to that 339 that you can see in the graph. And then the final chart is our running total. The blue bars represent the daily number of new cases reported. The red line represents the trend. You can see we reached a peak in this most recent and significant wave, kind of mid-July is when we peaked. You can see the descend is slowly coming down, and it's not a straight drop. It has a couple of points of kind of flattening, and then hopefully it continues to drop. You can see down here with today's numbers, we're seeing a little bit more of a drop in that line. So the 7-day daily average is 63. That is without the detention center in Robstown outbreak number. When you include numbers, and these graphs include those cases, when you include the detention center in Robstown, our daily average is 101, right? But that population we know is somewhat isolated, so we wanted to remove it to give you a different perspective. So 63 is our daily average of new cases. When you include an outbreak detention facility in Robstown, it almost doubles to 101. All right, so that concludes my presentation, and we're going to get it translated into Spanish, and then Annette Rodriguez will come up next.
En las últimas 24 horas se han reportado 63 casos confirmados por el coronavirus, más 29 casos reportados por el Estado en fechas anteriores. Aún continúan llevándose a cabo toma de especímenes en el centro de detención ubicado en Robstown. El promedio diario por los últimos 7 días es de 63 personas positivas al virus, sin incluir el brote ocurrido en el centro de detención en Robstown. Actualmente, 10.812 pacientes se han recuperado por completo, 173 personas continúan en el hospital, 76 están en la unidad de cuidados intensivos, 7.356 son casos aún activos. Hoy se reportan 3 fallecimientos, a la fecha los fallecimientos totalizan 339 personas. Ahora la directora del Distrito de Salud, Annette Rodríguez, nos va a dar su reporte.
Good afternoon, Annette Rodriguez, Health Director. The Health District would like to extend our condolences to the family of the 3 people that we lost to COVID-19 today. We did hold a drive-through yesterday. 45 individuals out of 59 scheduled came through, and 17 of those were positive. That calculates to a 30% positivity rate for that particular drive-through. If you are experiencing COVID-19 symptoms, contact our hotline at 361-826-7200 to get scheduled for the next drive-through. We also want to remind COVID-19 positive patients who need advice or are having concerns about their health to call the COVID-19 outpatient clinic at 361-826-8019. Physicians that are experts on COVID-19 are available to assist you. The hospitalization numbers of Nueces County residents has finally fallen below 200 people having to be hospitalized due to COVID-19 on a daily basis. A special thank you to all the hardworking nurses, doctors, infection control practitioners, and all the staff that work at the hospitals. These staff members have been caring for all of our COVID-19 patients. Their dedication to our community is truly appreciated, and we will be forever grateful. For those of you who have recovered, we continue to encourage you to donate convalescent plasma to help those who are critically ill. You must have had COVID-19 in the past and now are fully recovered to donate your blood. Here is the criteria for donating. You must be symptom-free for at least 14 days, be at least 17 years of age, and weigh at least 110 pounds. If you meet the criteria, please contact the Coastal Bend Blood Center at 361-855-4943 to schedule donating your blood. COVID-19 pandemic does continue. Even though our numbers may be lower than we have seen in a while, let's continue to do our part to reduce our numbers even more. We need our numbers back in the single digits for daily cases if we have any chance of success this fall. The fewer number of COVID cases we have going into flu season, the better off we all will be. And it will still be extremely difficult for all of us. Don't get comfortable with our low numbers. Be prepared for what is coming and what you will sometimes hear me refer to as our second wave of increased COVID cases in the fall. Preparations for flu season. What are some of the things that we can do? Get your flu shot this year. Even if you have never gotten a flu shot in the past, CDC recommends, the Centers for Disease Control and Prevention recommends that everyone 6 months of age and older get a flu shot. Flu season starts October 1st. Try and get vaccinated at least 2 weeks prior to flu season so that your body can build up some immunity. Also, try to get your medications refilled right now so that you don't have to be at the pharmacy or at your doctor's office during flu season, when we will be seeing increased cases. Continue to protect yourself and your loved ones by practicing public health strategies that have proven to be successful to reduce the possibility of contracting COVID-19. These strategies have worked and are worth repeating. Stay at home, especially if you are a vulnerable population. Practice social distancing with everyone outside your immediate household. Wear a mask when you leave home. Wash your hands frequently with soap and water for at least 20 seconds. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with anyone that is ill. Disinfect frequently touched surfaces at home and at work. Do not go to work sick. Stay healthy, stay diligent, and as always, stay informed. Thank you.
El Distrito de Salud quiere primero enviar su más sentido pésame para los familiares y amigos de las 3 personas fallecidas hoy por complicaciones del virus. Ayer se llevó a cabo una toma de muestras móvil. Fueron 45 las muestras tomadas, resultando 17 positivas, lo que hace un 37% de positividad. Si usted tiene síntomas y desea que se le haga una prueba, llame al 826-7200 para una evaluación. También le recordamos, si usted cuenta con el virus y necesita de orientación, llame a la clínica al 826-8019. Expertos están disponibles para ayudarlo. Finalmente, el número de hospitalizaciones en el condado de Nueces se reporta en menos de 200 pacientes. Le queremos agradecer a todo el personal médico por su entrega y profesionalismo para atender a todos ellos. Y para quienes se han recuperado, les seguimos pidiendo que donen su plasma convaleciente, el cual podrá ayudar a más personas a sobrellevar y tratar los síntomas del COVID-19. Entre los requisitos para hacer la donación es no contar con síntomas por más de 14 días, tener al menos 17 años de edad y pesar al menos 110 libras. Si cumple con los requisitos, comuníquese con el Centro de Sangre del Área de la Costa al 855-4943 para programar la donación. La pandemia por el virus continúa. Afortunadamente las cifras van disminuyendo, pero le seguimos pidiendo que no baje la guardia, más ahora que se acerca la temporada de gripe. Si es posible, tome la vacuna contra la influenza. Esa temporada comienza el 1 de octubre. Se recomienda que todas las personas mayores a 6 meses estén vacunados al menos con 2 semanas antes de la temporada. Así el cuerpo creará anticuerpos e inmunidad al virus. Continúe protegiéndose a sí mismo y a sus seres queridos practicando las estrategias de salud. Ahora la juez Bárbara Canales va a dar su reporte.
Good afternoon, everyone. Barbara Canales, Nueces County Judge. Before we get into the COVID part of our update, I first would like to, on behalf of Nueces County, extend our thoughts and prayers to all Texans and all of those of our neighbors in Louisiana that have been affected by Hurricane Laura. We are just really understanding the extent of the damage at this time, and we do know that there have been at least 2 confirmed deaths and severe destruction. As a coastal community, we understand just how devastating a storm can be, and we stand ready to help all of our brothers and sisters in this time of need. Please let this also serve as a reminder for our own residents that hurricane season is far from over. And as always, just like we say in public health, Stay informed and be ready. So let's talk about the storm, Laura, and its effects here locally. Even though this storm was at one point 870 miles away, we still feel its coastal effects all the way down as southerly as Baffin Bay. And as we approach this weekend, we want to remind everybody that beach access for the county roads number 4, number 5, and number 6 have been restored by order as of noon today, and you're able to enjoy the beautiful natural resources that are our Gulf beaches very safely and responsibly, I hope. Conditions, however, are always subject to change based on weather and cleanup efforts. And particularly around Bob Hall Pier, we ask for your patience as crews are working hard to do all of the evaluations, analysis, and yes, cleanup and repair from Hurricane Hannah. So we have these two weather events that are impacting us weekly. And I'm going to ask you that we be very mindful that when these orders come into play, it's because there is public safety involved. And I know that there was some chatter earlier today about, boy, there sure have been a lot of closures with regards to weather events on our Gulf beaches. Of course, this is true because when you have severe beach erosion like we experienced during Hannah, and you have another event that brings waters all the way to the dunes, driving on that beach can be not only hazardous, it's life-threatening. So make sure that you're monitoring our Nueces County website, our social networks. We often post regular updates, and we make those changes as necessary. It's always important to observe the signs that you see out at the Gulf beaches, and please, please be careful. Well, to be honest with you, my remarks today almost mimic and parallel Director Rodriguez's to a T. So I'm going to pivot a little bit and just echo that COVID clinic is really our safety net here for all cases that are positive of COVID-19. If you have a question, if you think that you need to visit with a medical healthcare professional, if you're worried that you don't have a primary care physician or don't have insurance, this is your answer. And if you do have a primary care physician, but they're not exactly, that's their expertise in infectious disease, this is a good place to go as well. So please be mindful of the numbers that we've put up on the board today. This clinic is free, and it's available, again, regardless of ability to pay, for those that have tested positive with COVID. And I also had written down about convalescent plasma. And I do believe that there are so many people out there that may just be a little bit concerned about what that process is all about. I was thinking that we would have a video that would demonstrate our how easy and just quick the process can be once you register online. And I also want to bring you stories from survivors who've received the gift of life so that you can feel the impacts of how important this can be. It can be private and very confidential, but I would encourage you, as Director Rodriguez said, please get online to the coastalbendbloodcenter.org and find out more information about the gift of life. So I'm going to pivot, our favorite word of 2020, right? Everybody pivots these days. And I'm going to pivot and make my final remarks about something that I am so excited about. And it's not going to be on our board, but we'll try to get this up on all our platforms. And that's about our library card sign-up. Everybody has one thing on their minds right now, and that's helping our students and our teachers. And we believe we have some answers for you here today. So I want to direct your attention for the entire month of September as we really promote Library Card Sign-Up Month. We're actually giving away book bags and lanyards, and we have all kinds of information on our Nueces County Library website, and we're asking people to take selfies. But the real exciting part is a program called Brain Fuse, and this offers free online tutoring, adult learning, and job search. It's not just for the little kids. So it's free online tutoring, adult learning, and job search. And so I think it's going to be really important that for those of you wondering, how am I going to help my children get help with their homework? How am I going to interact with the live tutor? What about forming online study groups for our high schoolers? How about practicing for standardized tests online, like the TSI to get into Del Mar? What about papers and writing labs that you know almost all of our kids now are asked to write research papers? All of this is going to be available free through www.ucmore.com/Nueces. Let me say that again, www.ucmore.com/Nueces. This would not be possible without a grant from the U.S. Institute of Museum and Library Services. But if you really want to know the truth, that's just the money part. This would not be possible without the dedicated men and women who work for Nueces County in the Library Services Department. And I'm so grateful because when we ask how they can help with COVID-19, they're not medical health professionals, but everything they're doing to help teachers, parents, and students learn is very good medicine. So I'm very excited about Brain Fuse, and if you need more information, don't forget, you can always call the county judge's office at 888-0444. But again, through the Nueces County Library System, you're going to be able to find everything online that you need. And I think that we all need a little bit of positive news, and I'm grateful for our numbers declining. I also want to say thank you again to the state of Texas for extending our request for staffing at Corpus Christi Medical Center today. For an additional 2 more weeks, all the way through September 11th, we will have additional state staff, nurses, and different therapists to assist our hospitals. Even though we've dipped below that 200 mark, such an important milestone for us. Let's not forget there are many, in fact, hundreds of people in our hospitals that are still in need, and that staff and those staffing requests from TDEM, Texas Department of Emergency Management, are absolutely critical. So once again, thank you to the Lone Star State for taking great care of Nueces County.
En cuanto al huracán Laura, antes de comenzar quiero enviar oraciones y mis condolencias a todos los afectados por el huracán Laura. Apenas estamos recibiendo información de la magnitud del daño ocasionado y el reporte de al menos 2 fallecimientos confirmados. Siendo residentes de un área costera, sabemos de lo devastador que un huracán puede ser, pero estamos preparados para ayudar y queremos recordarle que usted también esté preparado. La época de huracanes aún no ha terminado. En cuanto al acceso a la playa, ya se acerca el fin de semana y mucha gente espera acudir a la playa. El acceso ya se ha restaurado, pero le pedimos que si acude lo haga de manera responsable. Los accesos 4, 5 y 6 se encuentran abiertos. Estos cierres se han realizado debido a la seguridad del público. Las condiciones, sin embargo, están sujetas a cambios según el clima y los esfuerzos de limpieza, particularmente alrededor del muelle Bob Hall, que aún continúan. En cuanto a la clínica COVID es gratuita y está disponible para aquellos con o sin seguro médico que hayan dado positivo en la prueba. La clínica puede brindarle atención si necesite para ayudarlo a controlar sus síntomas, así como orientación. El número de atención es el 826-8019. Y para aquellos que se han recuperado del COVID, queremos recordarle que la FDA aprobó un tratamiento de emergencia para el uso de plasma extraído de sobrevivientes. Para más información, llame al Centro de Sangre del Área de la Costa al 888-0264 o en su sitio coastalbendbloodcenter.org. Asimismo, queremos también promocionar nuestras bibliotecas públicas mediante un programa llamado Brain Fuse. En el programa, que es en línea, es completamente gratuito para niños y adultos, el cual cuenta con tutores. Toda la información va a estar disponible en un sitio web a la dirección www.ucmore.com/nueces. Para más información, también puede comunicarse a la oficina al 888-0444.
Okay, this concludes our briefing. Is there any questions from the media? Okay, no questions today. Well, thank everybody for watching, and thanks for the media outlets that are covering it, some of whom are here in our audience, and some are working remotely. And so our schedule includes being back here on Tuesday, and that'll be with Dr. Bird, and some of us will be here as well, giving you an update on some of the numbers. But between today, Thursday, and Tuesday, we'll continue to update our websites. Both the city and the county share the same website. Our numbers are posted daily around 5 o'clock, and should there be a need to address the public in between now and Tuesday, we'll certainly do that. Remember to stay safe and continue to practice those COVID-safe protocols. Thank you.